All right, so a very good evening to all of you. So in this session, I will be continuing the COVID-19 updates, which I have stopped in my previous session. So before going ahead with the session, let me just introduce myself. I am myself Dr. Rajesh Guba. I'm the General Medicine Educator on Arise Medical Academy. So here I am there in front of you to give you a complete new updates on the COVID-19. Right, so I'll be giving you a completely new updates on COVID-19. So that is why I'm there here in front of you. Now if you take the updates related to your COVID-19, first thing in this session, what all I will be discussing. I will be discussing what are all the various new drugs for COVID-19, right? And second important thing is I will discuss what are the vaccines which are available for the COVID-19 as of now, right? So these are the two important things which I will be discussing in this session. So if you take the new drugs, right? The new drugs, what we are using as of now in critical or severe COVID-19 is your remdesivir. Everyone is aware of this particular remdesivir. And remdesivir is a very important molecule where definitely questions can be asked in your FMGE exam. I will tell you what are all the important points related to your remdesivir. But before that, let me tell you what are the antiviral drugs, right? Which are your antiviral drugs. The antiviral drugs like what we have is baloxavir. Baloxavir is a new antiviral drug. And then the convalescent plasma, right? But how much is this convalescent plasma efficacious? I will teach you in detail. Then we have favipiravir, then hydroxychloroquine. Everyone of us know that. So Donald Trump has made this hydroxychloroquine molecule very famous. And interferons, lopinavir or ritonavir. Then we have nitazoxamide, oseltamivir, remdesivir, and as well as the ribavirin. So these are the antiviral molecules. Now, what we are using in India as of now is the remdesivir in severe or the critical COVID-19. And you should be very much aware of the immunomodulators as well. Now, why you should be aware of this particular immunomodulators? Why? Because this particular immunomodulators, they will neutralize the cytokine storm. The important pathogenesis in COVID-19 is mainly because of the cytokine storm. And what are the cytokines which are released in these patients with the COVID-19? That is interleukin 6, then interleukin 10, then tumor necrosis factor. And these particular cytokines, they are released into the circulation, and these cytokines, they are the one which will cause multiple organ damage, right? These are the one which will cause multiple organ damage, lung injury, renal failure, cardiac failure, okay? And there can be involvement of the skin as well. Endocrine abnormalities in the form of diabetic ketoacidosis can be there. So all these various other manifestations is mainly because of the release of the cytokine storm. Now, in order to neutralize that particular cytokine storm, we have this immunomodulators, right? We have this immunomodulators. And what are these immunomodulators? We have, that is interleukin 1 inhibitor, that is anakinra, interleukin 6 inhibitor, that is tocilizumab, intravenous immunoglobulins, and then we have JAK2 inhibitor, that is baricitinib, right? Baricitinib. So these are the JAK inhibitors, and these are your immunomodulators, okay? Right. Now, after having discussed about the names of the antiviral drugs, and what did I tell you? The remdesivir. Remdesivir is a very important area where the questions will be definitely asked. Now, what all I will be discussing about the remdesivir right now? What is the mechanism of action of remdesivir? What is the dosage of remdesivir? What are the adverse effects of remdesivir? What are the contraindications of remdesivir? And what is the alternative drug if you are unable to give remdesivir? and what are the limitations of remdesivir. So these are the things like which I will be talking about related to your remdesivir. Okay, right. Let me tell you about the remdesivir first. Right. So if you take this remdesivir, you should know the mechanism of action of remdesivir first. Let me tell you, remdesivir, it is an antiviral drug which will inhibit the RNA polymerase. Right, which will inhibit the RNA polymerase. Okay, that is RNA polymerase of this COVID-19. Now, what this remdesivir is, it is a nucleoside analog of ATP that inhibits the RNA polymerase of the COVID-19. Now, by inhibiting the RNA polymerase, what is the problem? The problem to the virus is that it will inhibit the viral RNA replication. Right? It will inhibit the viral RNA replication. That is what is the action which is being done by your remdesivir. Mechanism of action. So, mechanism of action of remdesivir, it will inhibit RNA polymerase of COVID-19 and thereby it will inhibit the viral RNA replication. That is very simple. Now, see, initially when FDA has approved, the FDA has approved this particular remdesivir mainly for the adults and as well as pediatric patients of age group up to 12 years. Initially, they did not approve for age group less than 12 years and they did not approve for an individuals of weight less than 40 kg. Right? Less than 40 kg, remdesivir is not indicated. Right? Not recommended. Less than 12 years, remdesivir was not recommended. Right? Now, now the next point what I will be telling you about the remdesivir is that this particular remdesivir, what is the dosage of the remdesivir, right? Because the pandemic of the COVID-19 is going, being the medical students, we should be completely aware of what is the dosage of remdesivir. Loading dose, how much you should give. Maintenance dose, how much you should give. Let me tell you, in adults and as well as pediatric patients, more than 12 years, the loading dose of remdesivir, you should give 200 milligrams on day one. Right? The dosage of remdesivir is 200 milligrams on day one. That is first important thing. And followed by that, how many days you should give remdesivir? It all completely depends upon, right? It all completely depends upon whether the patient requires invasive ventilation or not. Right? Whether the patient requires invasive ventilation or not. If the patient requires invasive ventilator or if the patient is requiring ECMO, that is extracorporeal membrane oxygenation, in such case, you have to give remdesivir for nearly around 10 days. Right? In such case, you need to give remdesivir up to 10 days. 10 days you have to give. Whereas, you take in other way around. Right? You take in other way around. Like where the patient is not requiring mechanical ventilator, the patient is not requiring ECMO. In such case, remdesivir is given for 2 to 5 days. 100 milligrams, 2 to 5 days. Okay, only day one, the dosage is 200 milligrams. The remaining dose, the remaining days, the remdesivir, it should be given 100 milligrams. Remdesivir, it should be given 100 milligrams. Okay. So what is the first thing I have said you about remdesivir? Mechanism of action. What it will do? It will inhibit the RNA polymerase. Thereby, it will inhibit the replication of the virus. And the second important thing I have taught you is the dosage. 200 milligrams on day one and 100 milligrams or up to 10 days in patients requiring ventilator. 100 milligrams up to 5 days in those patients not requiring ventilator. All right. Next. Now, followed by that, what are the contraindications? Let me tell you, this remdesivir, it is metabolized in the liver and it is excreted in the kidney. And because it is excreted in the kidney, you should be doubly sure whether the kidneys of the patients are functioning or not functioning. For suppose, if the GFR of the patient, right? For suppose, if the GFR of the patient, if it is less than 30 ml per minute, then in such case, remdesivir should not be given. That is one thing. And the second contraindication for remdesivir is that if there is any history of hypersensitivity reactions, right? If there is any history of hypersensitivity reactions, then also remdesivir is contraindicated. Then also remdesivir is contraindicated. So please remember these 2 points. History of hypersensitivity reactions are there, don't give remdesivir. Estimated GFR is less than 30, please don't give remdesivir, right? And the next important point about the remdesivir is, I said you that remdesivir, it gets metabolized in the liver. Now, whenever the patient is on remdesivir, you should do a close monitoring of the ALT, right? You should do a close monitoring of the alanine aminotransferase levels. If the alanine aminotransferase levels have increased more than or equal to 10 times, then in such case, the remdesivir should be stopped, right? Then in such case, the remdesivir has to be stopped, okay? Right. So I'm sorry for the interruption. Right. So now, whenever the patient is on remdesivir, you have to do a close monitoring of the alanine aminotransferase levels. If the alanine aminotransferase levels have been elevated more than or equal to 10 times, please withhold remdesivir. Don't give remdesivir. Okay. And infusion related reactions that have occurred in patients receiving remdesivir, that is also an immediate contraindication for your the remdesivir. Okay, these two are very, very important points, right? Next, then followed by that, the other important point what you need to know is the application of remdesivir in special population, right? What do you understand by the word special population, right? If the patient tells, right, sir, my wife is pregnant, can I take remdesivir? Right? Can she take remdesivir? Let me tell you, there is no adequate data or there are no well-controlled studies in pregnant individuals about remdesivir, right? And if the patient tells, right, that I'm lactating, I'm the nursing mother, can I take remdesivir? I am COVID-19 infected. Even in nursing mothers, there are no particular studies proven about the remdesivir in nursing mothers. Next, in pediatric patients, actually initially FDA has approved remdesivir more than 12 years, more than 40 kg. But later, FDA also has approved remdesivir even for weight of the individual less than 40 kg also. Now, what is the dose less than 40 kg? I will tell you. Next, in geriatric patients, right? In geriatric patients, yes, geriatric patients can take remdesivir. But the only point is you should do a close monitoring of liver function test, right? Close monitoring of the renal function test, right? And close monitoring of the cardiac function. Right. And what about in the renal impairment? What about in the renal impairment? I have already said you, when the estimated GFR is less than 30, please don't give remdesivir, right? Please don't give remdesivir. And regarding the hepatic impairment also, I have said you, if the alanine aminotransferase levels, if they are elevated more than or equal to 10 times, right? If alanine aminotransferase levels, if they are elevated more than or equal to 10 times, please stop giving remdesivir. So this is the FDA approval for remdesivir in the special populations, right? In the special populations. Okay, next. Now, the next important data is in the pediatric patients of, right? Pediatric patients of age less than 12 years and weight less than 40 kg. What is the dosage of the remdesivir? What is the dosage of remdesivir? The dosage of remdesivir in pediatric patients less than 12 years or less than 40 kg is, on day 1, you have to give 5 milligrams per kg. Whereas the remaining days, the maintenance phase, what you should do is you have to give 2.5 milligrams per kg, right? 2.5 milligrams per kg for 2 to 5 days, right? For 2 to 5 days. That is in pediatric patients. So to summarize remdesivir, remdesivir is an antiviral drug against COVID-19. Remdesivir, it will inhibit the RNA polymerase. Remdesivir, it will inhibit the viral replication. And remdesivir, the dosage is 200 milligrams on day 1, 100 milligrams subsequently, right? You should give 100 milligrams subsequently. So 100 milligrams subsequently in the sense, you need to give 100 milligrams up to 10 days in ventilated patients, the patient on mechanical ventilator. You have to give 100 milligrams for 5 days in patients who are not on mechanical ventilator. Okay, so that is about the dosage of remdesivir. And what are the contraindications for remdesivir? Patients with hypersensitivity reactions, don't give remdesivir, right? And as well as patients with renal failure with estimated GFR less than 30, don't give remdesivir. And hepatic impairment, alanine aminotransferase levels have been elevated more than or equal to 10 times, don't give remdesivir. And history of any hypersensitivity reactions are there, don't give remdesivir, right? Next, in the special populations, like in pregnant females, nursing mothers, right? There are no well-controlled studies until now. In pediatric patients less than 12 years, the dosage should be 5 milligrams per kg on day 1 and 2.5 milligram per kg from day 2 to day 5. This is the maintenance dose. So that is about the story of your remdesivir. Now, after having discussed about the remdesivir, let me tell you about the role of the corticosteroids. Role of corticosteroids is very much there in the treatment of COVID-19. And immediately the question that is asked is, which particular corticosteroid is used? Which particular corticosteroid is used? It is mainly dexamethasone, right? It is mainly dexamethasone which is being used. Okay, that is a corticosteroid which is being used, right? Next, followed by that, what is the warning whenever you are giving dexamethasone? What are the precautions you should take? Remember, dexamethasone will suppress the immunity of the individual. And in immune suppressive individuals, they are more prone for fungal infections, right? They are more prone for fungal infections. Dexamethasone is the one which will reduce the immunity of the individual. So that is the reason why, please remember this point. If the individual is already having any fungal infections, please don't give dexamethasone. And even in the pregnancy, in pregnancy, dexamethasone is category C, right? Category C. We don't give this dexamethasone in pregnancy. Now, in which group of patients dexamethasone is required? Dexamethasone is required in critical COVID-19. Dexamethasone is required in severe COVID-19. Now, what is critical COVID-19? What is severe COVID-19? Already I have taught you this in my previous session also, but let me shortly revise. You take critical COVID-19. critical COVID-19 means the patients who has developed ARDS, the patients who has developed sepsis, the patients who have developed septic shock. This is what is called as the critical COVID-19. Patients with ARDS, sepsis, and septic shock. They should be given dexamethasone. Whereas you take in case of severe COVID-19. What is severe COVID-19? Room air oxygen is less than 90%. There is a tachypnea, respiratory rate is more than 30, right? And there are signs of respiratory distress. In these patients, you should definitely give dexamethasone. Whereas in case of non-severe COVID-19, in non-severe COVID-19, we don't require to give the corticosteroids, right? We don't require to give corticosteroids. Okay, so no corticosteroids in non-severe COVID-19. So that is about the role of the steroids, right? That is about the role of steroids. Now, the next important thing is you need to know about the coagulopathy in COVID-19. Why there will be coagulopathy in COVID-19, right? Why there is coagulopathy in COVID-19? Now let me tell you this point, why there is coagulopathy in COVID-19. Why there is coagulopathy is because this COVID-19 is associated with what is called as endothelitis, right? It is associated with what is called as endothelitis. Why there will be endothelitis? Why? Because on the endothelium, right, on the endothelium of the blood vessels, there are ACE2 receptors, right? The density of ACE2 receptors on endothelium is very high. Now, this particular COVID-19, once it binds to this particular ACE2 receptors, once it binds to the ACE2 receptors, that will cause the endothelitis. Okay, so there is high density of ACE2 receptors on endothelial cells. So once there is development of endothelitis, there is activation of your virtuous triad, right? There is activation of the virtuous triad. What is virtuous triad? Virtuous triad is that where the individual has high chance of the hypercoagulability or thrombus formation. So any one thing in the triad, like vascular endothelitis, or if there is platelet activation, or if there is endothelial dysfunction causing altered blood flow, any one will trigger the remaining, right? Any one of this particular triad will trigger the remaining, and that will cause the hypercoagulability. And in order to check that particular hypercoagulability, right, in order to check that particular hypercoagulability, we have to do the D-dimer levels. Right, we have to do D-dimer levels in order to check whether the individual has developed hypercoagulability. Now, for suppose, if the D-dimer value is less than 500, right? If the D-dimer value is less than 500, then you give prophylactic anticoagulant. Whereas if the D-dimer value is elevated, right? D-dimer value, if it is in the range of like 2000 to 10,000 nanograms per ml, in such case, you need to give therapeutic anticoagulation, right? In such case, you need to give therapeutic anticoagulation. Okay, so that is about the requirement of the anticoagulation. Prophylactic, if the D-dimer is less than 500. Therapeutic, if the D-dimer is in the range of 2000 to 10,000 nanograms per ml, right? 2000 to 10,000 nanograms per ml, then you need to give therapeutic anticoagulation. And what is that anticoagulation we will give? Low molecular weight heparin is preferred, right? Low molecular weight heparin is preferred. Okay, so you might have come across that the patients presenting with cerebrovascular accidents, patient presenting with coronary artery disease, patients presenting with transient ischemic attack due to COVID-19. Why is that? That is because of endothelitis. And that is the reason why you need to give prophylactic or therapeutic anticoagulation should be given. Okay, so that is about the role of your heparin. Next, followed by that, now we have seen that related to remdesivir, right? Related to remdesivir, we have seen certain challenges. Like, what are those challenges of remdesivir? The challenges of remdesivir is that remdesivir should not be given if the estimated GFR is less than 30. Remdesivir should not be given. If there is hepatic impairment, remdesivir should not be given. If there is chronic kidney disease, remdesivir cannot be given. Now, in order to take these particular challenges, we have a new drug which is under trials. That is, right, the new drug is bamlanivimab. Right, the new drug is bamlanivimab. That's a new drug. Now, this particular drug is in actually phase 2 trials only. It did not complete the phase 3 trials. It is only after completion of the phase 3 trials, then it is released into the market. But still it is in phase 2 trials. But what the FDA has done, because now we have a challenge now. What is the challenge? We don't have any other drug if we cannot give remdesivir. So what the FDA has done is, right, FDA has given an emergency use authorization, right? Okay, patient is having critical COVID-19, estimated GFR is less than 30, I cannot use remdesivir, then what is the alternative? For that reason, FDA has given the emergency use authorization, right? And that particular drug which has been approved for emergency use authorization is bamlanivimab, right? It is immunomodulator, right? It is immunomodulator, which is nothing but bamlanivimab. Okay, now this particular bamlanivimab, what is the dosage of this particular bamlanivimab? The dosage of this particular bamlanivimab is 700 milligrams. You have to give bamlanivimab of 700 milligrams over at least 60 minutes, right? Or within 1 hour, you need to give 700 milligrams of bamlanivimab. And that is what is advised for the emergency use authorization, right? That is what is used for emergency use authorization. Okay, so this is a very, very important point. This bamlanivimab has achieved an emergency use authorization. Even though it did not complete the phase 2 trial, phase 3 trials, it has been released into the market because there is no other drug apart from your remdesivir. And that is the reason why bamlanivimab has been come. Now, in which group of patients this bamlanivimab can be given? This bamlanivimab can be given in CKD or diabetic patients. Bamlanivimab can be given in immunosuppressive disease. Bamlanivimab can be given in patients more than or equal to 65 years of age. Bamlanivimab can be given if the BMI of the patient is more than or equal to 35, also we can give bamlanivimab, right? So in those individuals where we are unable to give remdesivir, the new drug which has received the authorization, emergency authorization by FDA is your bamlanivimab, right? So that is about the new drugs. That is about the new drugs. So what all I have discussed until now? I have discussed in detail about the remdesivir. Then I have discussed where we should give corticosteroids, dexamethasone. Then I have discussed why there will be hypercoagulability in patients with the COVID-19. If there is hypercoagulability, what is the treatment you should give? Then I have discussed about the bamlanivimab, right? Then I have discussed about the bamlanivimab. All right, next. Then followed by that, let me teach you about the vaccination, right? Let me teach you about the vaccination. Right. Right. So if you take the vaccine development, yes. So if you take this vaccine development, until now, the vaccine development is going all over the world. Multiple places, the trials are going on for the vaccine development. But until now, right? But until now, the vaccines which has received FDA approval is only 2 vaccines. Right? Only 2 vaccines have received the FDA approval. Almost like 86 vaccines, right? Almost 86 vaccines all over the world, they are in the preclinical phase, right? And 41 vaccines, they are in phase 1. 16 vaccines, they are in phase 2. And another 16 vaccines, they are in phase 3. Right? Another 16 vaccines, they are in phase 3. Okay? The one which have received approval by the FDA, only 2 vaccines have been received approval by the FDA. Now, what are those 2 vaccines? Right? Those 2 vaccines include vaccines by Pfizer and vaccine by the Moderna company. Now, what are those 2 vaccines? That is BNT 162B2, then mRNA 1273, right? mRNA 1273. These are the 2 vaccines which has received approval by the FDA. Okay, now the next important point is what should be the vaccination schedule of this particular Pfizer vaccine and as well as the Moderna vaccine. Now, if you take the Pfizer vaccine, right? If you take the Pfizer vaccine, you should give 2 doses. That is on day 1 and as well as day 21. Right? Day 1 and day 21, you should give 2 doses of the Pfizer vaccine. Whereas Moderna vaccine, you should give on day 1 and as well as day 29. Right? Day 1 and day 29, Moderna vaccine. Day 1 and day 21, the Pfizer vaccine. And all of those, they are mRNA vaccines against COVID-19. Right? mRNA vaccines against COVID-19. And Pfizer has said that you can give my vaccine to individuals more than or equal to 12 years. Moderna has said that you can give my vaccine of age group more than or equal to 18 years. That is what is the recommendations by the respective companies. And what is the efficacy of these particular vaccines in inducing the immunity? And in both of them, either you take Pfizer vaccine or you take Moderna vaccine. In both of them, the development of immunity is after the second dose. Right? The development of immunity is after the second dose. You take the Pfizer vaccine. Pfizer vaccine, the individual will develop the resistance or immunity after 7 days after the second dose. And Moderna vaccine, the individual will develop resistance or immunity 14 days after the second dose. Right? 14 days after the second dose. And Pfizer vaccine, 95% efficacious. Moderna vaccine, 94.5% efficacious. Right? 95% efficacious Pfizer vaccine, 94.5% efficacious Moderna vaccine. So this is about the vaccines. Now the question is, right? Now the question is, who are the ideal candidates? Who are the ideal candidates? An individual more than or equal to 12 years or individual more than or equal to 16 years are the ideal candidates for the respective vaccines. And these vaccines, they can be stored at the refrigerator temperature. That is Moderna vaccine, that is mRNA 1273. It is stable at the refrigerated temperature for almost 30 days. Whereas the stability of your BNT is at more than or equal to minus 70 degrees centigrade. Okay, right. And what is the contraindications? In those individuals who have history of allergic reactions, right? In those individuals who have history of allergic reactions or anaphylaxis, this Pfizer vaccine is contraindicated. And this Pfizer vaccine should be given in 2 doses, that is 0.3 ml each. Right? You should give 2 doses, 0.3 ml each, and that should be given intramuscular. That should be given intramuscular. So that is about the Pfizer vaccine, right? That is about the Pfizer vaccine. Okay. So this is in short about the vaccination. Now, the other point is, like, there are certain warnings given by the Pfizer company in special populations. In pregnancy, they did not do any studies. In lactating mothers, they did not do any studies. And in pediatric patients less than or equal to 16 years, they did not do the study. So please remember this. Before giving the vaccine, check whether is she pregnant, is she lactating, like, or the pediatric less than 16 years. Okay. So for them, the Pfizer did not do the studies on them. Okay. So this is about the vaccination. So to summarize about the vaccination, we have only 2 vaccines until now. One is Moderna vaccine and the other one is Pfizer vaccine. Pfizer vaccine should be given in 2 doses, day 1 and day 21, and the age of the individual should be more than or equal to 12 years. And Moderna vaccine should be given on day 1 and day 29, and the age of the individual should be more than or equal to 18 years, right? And the development of immunity in case of the Pfizer vaccine is 7 days after the second dose. And development of immunity regarding the Moderna vaccine is 14 days after the second dose. Right? And efficacy wise, Pfizer vaccine 95% efficacious, Moderna vaccine 94.5% efficacious. Okay, so that is the primary endpoint, right? That is the primary endpoint, and you should know where they can be stored. The next point is the dosing. 2 doses of 0.3 ml each intramuscularly should be given, right? 2 doses of 0.3 ml each intramuscularly should be given. And the special recommendations is that in pregnancy, lactation, pediatric patients, this Pfizer vaccine cannot be given. So this is in summary about the new drugs and as well as the vaccines, right? So this is a very, very important session about how we have to use remdesivir, when we have to use corticosteroids, why there is coagulopathy, what are the vaccines, right? But by the time you go to the exam, 1 month before or 15 days before, you have to know the update, what is going on, and then go to the exam. Why? Because every day you are having a new update related to this particular COVID-19. So you have to go through this particular update properly before going to the exam, and then attempt the exam and then give the updated answers in your exam. Okay. So with this, I will wind up this particular session, and I'll see you again in the upcoming sessions. Thank you very much. So I hope that I have given you a completely recent updates related to your COVID-19. Thank you very much.